Hello, I'm Robin Young. I am a breast medical oncologist with the Center for Cancer and Blood Disorders. From an early age, I've always wanted to help people, but I've also been interested in science, the how and the why things work or why they don't work. As we need basic scientists to uncover the pathways that control cancer cells, we also need doctors in the clinic to prove that these targeted drugs actually work to help our patients. I did not plan to become a subspecialist, but after my fellowship, I found myself seeing more and more breast cancer patients as the only female on staff. And I found my true passion and my true calling treating breast cancer patients. I already knew that to really make a difference in the world, we need better cancer treatments. I'm not a basic science researcher in a lab, but I am a clinical trialist in the clinic, helping to bring these new treatments to my patients. Many years ago, before I came to Fort Worth, I was involved in a trial called the ATAC trial, anastrozole versus tamoxifen, and the combination of anastrozole and tamoxifen for women who had completed surgery but had a risk of cancer recurrence anywhere in the body. That trial established that anastrozole was superior to tamoxifen in preventing breast cancer recurrence. Anastrozole is now standard treatment for postmenopausal women in the curative setting. I remember having a patient with aggressive HER2-positive metastatic breast cancer back when we were just beginning to even check HER2 on tumor specimens. And I knew that it was a really poor prognosis. Most of those women took every chemotherapy drug we had and they still died in a year. I have to be so grateful that I got to participate in the pivotal trial of trastuzumab, a drug that doubled survival. And now, with our modern treatment, survival for HER2-positive metastatic breast cancer is 5 years. I've had the privilege to be the principal investigator for all the breast cancer clinical trials over the last 20 years at the center. These trials included the AFFINITY trial. That resulted in the approval of pertuzumab in the curative setting for breast cancer patients with HER2-positive disease. And in the metastatic setting, we participated in the clinical trial of capivasertib, which is used with endocrine therapy for women with hormone-sensitive metastatic breast cancer who have mutations in certain genes. Breast cancer treatment is my passion and calling. Woman to woman, I bring you that special understanding about the effects of this disease. The part that goes beyond the physical aspects, the questions you have about your femininity, your doubts, your fears. I have been on the other side of the cancer table, having lost my father to lung cancer. There were times during that journey when I felt like I didn't get the whole story. I welcome your questions and your concerns. We'll walk through the breast cancer journey together. You are not in this alone. Cancer won't wait. Hope is here at the Center for Cancer and Blood Disorders.